So basically, I'm going to go over just some basic skincare, pressure injury management, and some wound prevention. So first off, as with anything, prevention is key. This was just a little mnemonic that I had kind of made up that covers almost every interventional activity or task that you can do to maintain the health of your skin. So first off, there's this concept called skin tolerance, which I actually wasn't very familiar with until I started researching spinal cord injury, pressure injury risk, and prevention. Skin tolerance is where it's an exercise where you are applying pressure to certain bony prominences on your skin for 15-minute intervals, and you build up the length of time over a period of time, and it builds up the tolerance of your skin to pressure. So if you are applying pressure to, let's say, your elbow for 15 minutes, it's going to look pretty red. You want that redness to go away within 30 minutes or so, or even less time. If it's taking longer than 30 minutes, then you know that the tolerance of your skin in that area is still pretty low. So you build up that tolerance over time to a point where, you know, when you've got pressure on an area for 30, 45 minutes, once you remove the pressure, the redness should go away within 15 to 30 minutes. Cold and heat awareness. So whenever there's a spinal cord injury, oftentimes wherever the injury is from there downward, there's a decreased sensation to pain, to heat, to cold, to pressure. And so it's very easy to get burned, maybe on the bottoms of the feet, or if you're outside enjoying some sun, maybe you're not realizing how much sun your skin is getting and not feeling that it's starting to really warm up and get hot, and you're going to get sunburned a lot more easily. Also, if you do get burned either by, you know, extreme cold or heat, because of the nerve spinal cord injury, there is a lot that goes into interfering with that healing process. And so if you do get a burn, it's going to take a lot longer to heal, and there can be complications in that healing process due to the nerve injury. We want you to inspect your shoes and clothes for proper fit. Too tight fitting shoes or clothes, or shoes that maybe aren't fitting very well and they're rubbing against your skin over and over and over again in the same spot, those can cause different types of frictional injuries or pressure injuries that you may not be aware of because of that decreased sensation. So always having good, comfortable, properly fit shoes and clothing is really important. Sun protection, making sure that you're putting on between 30 and 50 SPF sunscreen on all exposed skin in the sun, wearing hats, wearing clothing that's protecting your skin from sun exposure. All of those things, again, really important due to that decreased sensation. Keeping linens wrinkle-free. A lot of people don't think about this because we just don't realize that something as small as a wrinkle can cause skin damage. But wrinkles can apply really significant pressure to your skin. And if it's there for an extended period of time, you can develop a pressure injury and skin breakdown from that. So making sure that your sheets are fitting really well on your bed and that everything's kind of straightened out on a pretty regular basis. We want you to inspect your skin daily. This is really important. All of those areas, especially on the bottoms of the feet and on the tailbone and buttock area, where it's kind of difficult to see, our visual field isn't really, you know, scanning those areas on a regular basis. We want to make sure that you or a loved one that you lived with or a caregiver is looking at your skin every day to identify any areas where, you know, there's been long-term exposure to pressure or heat or cold or sun or whatever. And inspecting your skin daily is also really important because that's how we identify the damage to our skin. And if we are inspecting daily, then we're pretty much guaranteed to identify breakdown in the early stages of that injury development. So, you know, instead of discovering maybe a stage 4 pressure ulcer, If you're inspecting daily, you'll discover a stage 1, and you can do things to reverse that damage a lot more quickly. Nutrition and hydration is really important. We want to have good balanced nutrition. If our skin is not hydrated and it's very dry, it's much more likely to break down more quickly. Cleanliness, of course, so making sure that our skin is clean and dry. That doesn't mean that you need to take a shower or bath every day or even every other day, but just making sure that you know, if we have skin folds and creases in our skin that aren't being cleaned very well, you get like sweat buildup and dirt and grime that sort of accumulates. And if that's sitting there for a long period of time, it's going to start to eat away at those top layers of the skin and cause some breakdown. Applying lotions and creams kind of goes with that daily hygiene and cleanliness. Again, if your skin is really dry and flaky, the integrity of the skin is compromised. It's going to tear more easily and it's going to break down more quickly. So applying, you know, good lotions and creams on a regular basis, especially if you have dry skin, which I think we all have in Arizona, unfortunately. So repositioning every 2 hours. So whether you're sitting in a chair or you're in your bed, making sure that you're shifting your weight. If you can't do that effectively, making sure that there's someone there that can assist with repositioning. And the repositioning doesn't need to be this huge dramatic, you know, turning all the way from side to side, but just, you know, putting a pillow underneath the butt cheek or, you know, propping up your arms with pillows, shifting that weight periodically when you're sitting in your chair. All of those things are adequate to redistributing that pressure to other parts of the body so that no one area is getting extended exposure to pressure. And then the last letter E in that SCI, skincare or mnemonic, stands for equipment. And that covers really a broad range of things. So first, we want to make sure that whatever equipment is being used, that it's properly fitted and that it's functioning well. If you have broken pieces on your wheelchair or if you're using a hospital bed, it's not going to function the way it's intended to. It may rub up against certain bony prominences in other parts of the body, causing skin breakdown pretty rapidly. We want to make sure that if you have to use a brace of any kind on an extremity or a body part, we want to make sure that that brace is fitting well and that it's not worn down to the point where, you know, you have hard plastic rubbing on your skin. The other thing with equipment that I'm sure all of you are very well aware of already is the seat cushions and the padding, particularly on wheelchairs. It has a limited lifespan. So I know that every insurance is different, but I think in general, most insurances cover a new wheelchair seat cushion every 5 years. So you want to make sure that you're being proactive in contacting your insurance provider and the company that you're getting your durable medical equipment from so that that can be replaced on a regular basis. That's really key to preventing pressure injury development. So this slide just covers various pressure points when you're in different positions. So when you're on your right or left side, your ear, hip, knee, and ankle are going to be those really high risk areas that you want to be aware of. When you're on your back, the back of your head, your buttocks, particularly the sacral spine area, shoulder are at really high risk. The two most common areas for developing a pressure injury are to your sacral spine and your heels, especially when you're in bed for extended periods of time. So just, again, making sure that you have a really good mattress or an overlay, whether that's gel, memory foam, an air mattress overlay, any of those things can be effective in helping with that pressure redistribution. But it definitely doesn't mean that you don't need to shift your weight on a regular basis or use pillows for repositioning so that your weight is shifted properly. And then with,
Nikki?
Oh yes.
I just ordered a Proactive Protect mattress.
Okay.
For my bed. Are you familiar at all with them?
I'm not, no. is that like a memory gel foam or is it an air mattress?
It's a combination memory foam and gel.
Oh, nice.
And because right now I just have a thick foam with an egg crate thingy over it.
Yeah.
And I can tell it's getting my butt sinking in it.
Yep.
And so I just wanted to ask if you happen to know about any of the proactive mattresses.
I don't, but I will say, Valerie, that I think that the combination memory gel mattresses, I feel like are a little bit more supportive than just a memory foam mattress. Sometimes the memory foam mattresses can be like almost too soft. So it really doesn't support your back. And I mean, it's okay for maybe like a little kid, but for us, you know, fully grown adults, it's not very helpful for our support back well. So yeah, you'll have to keep me posted on that mattress and what you think about it.
Okay.
Because that, you know, that really is, I mean, I think, you know, whether or not we have a spinal cord injury, finding a good mattress for our bed is really, you know, a big struggle, right? And there's so many different products out there nowadays. So, but especially, you know, when you have decreased sensation, having a good mattress that really helps with decreasing the pressure that's experienced, especially on the heels and on the sacrum, is so important to your skin health. So that's great that you were able to find that.
I know we have a Tempur-Pedic beds.
Oh yeah, those are awesome.
Love it.
Yes.
Of course, my husband still puts pillow under my ankle, pillow between my knees, pillow behind my back. And
yeah. Oh, that's great. Yeah. Yeah. The Tempur-Pedic mattresses can get really pricey, but if you can afford it, or if, I don't know if insurances for certain types of injuries will cover things like that nowadays, but that's always a really great option, is the Tempur-Pedic mattress.
Yeah. And a lot of places, when we got ours, they had 5 years, no interest.
Oh, so, yeah. Oh, yeah. That's really,
okay, sign me up.
Yeah, seriously. That makes it a lot more manageable for sure.
Yeah.
Well, I'll let you know, Nikki, if I give it a thumbs up or a thumbs down.
Yeah. Let me know. I'm curious about it.
Keep us
so you can let other people know.
Okay. Oh, yeah, definitely. That's great. So with your wheelchair, the main areas of breakdown are going to be, again, at the heels, but also at the ball of the foot and then the buttocks. So your sit bones are really kind of pushing into your bottom area. And when you're sitting in your chair for extended periods of time, that's really at high risk for breaking down. And I'll go over some different types of pressure redistribution surfaces for both sitting and lying in bed in just a few slides. So recognizing early signs of pressure injury, relieving pressure and watching closely when you see an area of redness on your skin that doesn't blanch. And what blanching means is when you have a red spot and you push your finger into that spot, it should turn white and then immediately turn red again. If you push down and it never changes color, it just stays red, that means that it's non-blanchable, and that would be considered a stage 1 pressure injury. So these two pictures are examples of stage 1 pressure injuries. It's important that you really understand that redness to the skin is an early sign of pressure injury development, because if we can catch any skin injury at this stage of the game, you're going to be in really good shape. When the skin starts to break open, that's where we start to run into problems, and you run the risk of battling a chronic wound for months or years on end. So just again, that early, that everyday inspecting the skin and identifying those reddened areas early on is key to preventing a lot of headache and a lot of expensive wound care. So setting the stage. So these next slides are going to be pictures of different types of wounds. So if you're a little bit squeamish, you might want to look away. The first picture is a stage 2 pressure injury. That's where the breakdown, where the wound extends through the top layer of skin into the second layer of skin. So it's pretty shallow. This is still an early on pressure injury, skin breakdown, whatever you want to call it. If the skin is broken open and kind of looks like this first picture on the left-hand side, you can put a silicone foam dressing. There's multiple companies that make foam dressings. These are really nice because they're really gentle on the skin. The silicone layer is very soothing and promotes healing. It has a little bit of absorbent properties and just does a really great job of protecting that wound bed and not disrupting that healing process. And the foam dressings can generally stay on for about 5 to 7 days. If the only thing with foam is that you can't get it wet. So if you're taking a shower, you're going to have to either cover it with plastic or take it off. Your next picture over is a stage 3 pressure injury. So that means that the injury has extended down into the subcutaneous layer, or maybe it's still kind of a shallow wound, but there's some dead tissue inside in the wound bed, which we call slough or eschar. So this picture, you can see the injury is actually starting to heal. You can see some scar tissue formation around the edges, and it goes down into that fatty layer, and it has that yellowy, whitish tissue in the middle. That's just dead necrotic tissue, and we want to clean that up. So you can put some Meta Honey on there, or a product called Spinal, which is an enzymatic ointment. Both of those products do a really good job of breaking down any necrotic tissue in the wound bed, cleaning it up, making sure the wound stays really nice and moist. And then you would cover it with a gauze dressing, or again, a silicone foam dressing to maintain that moist wound healing environment. Next picture over is we call that an unstageable pressure injury. So whenever you cannot determine the true depth of the wound bed, that would be called unstageable. So this wound is almost 100% covered by necrotic tissue. So I can't really say for sure how deep the wound goes down, but I do know that it's guaranteed to be a stage 3 or a stage 4 pressure injury once it's all cleaned up. Again, you can put Santal, the enzymatic debriding ointment, or Meta Honey silver gel, any sort of wound product that brings some moisture to the wound bed that promotes debridement, cleaning up of that wound bed. Next picture, we have again, another unstageable pressure injury. This is an injury to the heel, and it's covered with hard, dry eschar. So in this case, unless the eschar is lifting and you have softness or drainage coming out around the edges, you just want to cover this with maybe a dry gauze dressing, or potentially just leave it open to air. The eschar can act like a biologic dressing, a natural biologic dressing. And if it goes undisrupted, generally the body will start to heal underneath that eschar, and by the time it's fully healed underneath, the eschar just falls off like a scab. If you see a wound like this, you can again use a silicone foam dressing, or use one of these foam cushion cup things that are intended for the heel area. So all kinds of products out there for pressure injuries depending on the location of the injury on the body. The middle picture is a deep tissue injury. So you can see that the skin is intact, but the discoloration of the skin is like a purple maroon discoloration. That's consistent with a deep tissue injury. And these often happen when, again, you've got prolonged pressure to a particular area and the injury extends down into that fat layer, but the skin hasn't actually broken open. A lot of times with these types of injuries, they do break open and they look worse before they get better. Sometimes, if you can relieve that pressure early on, the deep tissue injury will resolve on its own without the skin actually breaking open. One of the ways that you can prevent injuries to heels is by using heel protector boots. And I have 2 examples of those below that picture. There's all kinds of heel protector boots out there. So I encourage people to read reviews and look for something that has a really good lining on the inside so that your skin doesn't sweat or get exposed to plastic, and has a good fit. These can help keep your heels elevated off the bed if you have a hard time using pillows to elevate your heels. Last picture is a stage 4 pressure injury. So this is a full thickness pressure injury that extends down into either muscle, tendon, or bone. A lot of times we'll see stage 4 pressure injuries to the heels and the sacrum again. Also, oh, did somebody have a question? Okay. With this deep of an injury, a lot of times we have to get more aggressive with wound care. A really effective way to manage a wound like this is with negative pressure wound therapy, or the other kind of generic name is a wound vac. I don't know if any of you guys have heard of these before or know people.
I haven't, no.
You haven't, Sarah? Okay.
No,
So a wound vac is, or negative pressure wound therapy is where we would apply foam to the wound bed, and then we hook it up using tubing to a machine that delivers negative pressure to the wound bed. And negative pressure technology, as it relates to wounds, just promotes cellular migration to the wound bed, and it speeds up the healing process. So it promotes growth of all the tissues that are needed to resurface a wound. So it's a really nice option. Other options for like heavily draining deep wounds would be like a silver hydrofiber dressing, or sometimes Meta Honey or silver gel if the wound bed is dry.
I had the wound vac on mine.
What's most important to realize here is that if you have any sort of skin injury that is beyond a stage 2 pressure injury, you want to go see your primary care physician as soon as possible and get some, consistent follow-up care, whether that's at the office or you get home health ordered and you have somebody following your wounds on a regular basis. I'm just kind of trying to give you guys a little bit of an introduction on what these wounds are called, how we stage them, what they look like, so that you know for your own knowledge, and then what some of the common management techniques are for treating these wounds.
I have a question.
Yeah.
Could an ingrown toenail be considered a pressure injury or lead to one? That was something
that wouldn't be considered a pressure injury, but it can definitely lead to a bad wound. And ingrown nails can get infected really easily. And if you're not feeling that it's getting more and more painful, it's going to get worse and worse over time. So that's definitely something that is important. Having good like foot hygiene, keeping your nails clipped pretty short, and just looking at your feet regularly to make sure that you're not developing any sores from shoes or anything else is really important. So if you see any of these injuries developing or worsening on your body, definitely seek medical attention. This slide just covers some basic do's and don'ts for pressure redistribution. So on the left-hand side, we have a couple of examples of different types of products that are really outdated. So the donuts aren't really recommended anymore. I know for some people they still work and some people really like them, but in general, they really just apply pressure to other areas and they put a lot of strain on the skin in that center of the donut. So we don't really recommend those. The upper left-hand picture of the foot, that has like a little sheepskin cloth on the heel. That's nice and soft, but it doesn't decrease pressure to the heel. It's not lifting the heel off of the surface. It's just got a layer of fabric now between the heel and the bed, or the heel and the wheelchair. So that's not really going to do a whole lot. Plus, half of the foot is still exposed. And then the other picture of the person with their hand on their skin is just to illustrate somebody rubbing on a reddened area. If you have an area that you identify as really red and kind of angry looking, rubbing that area with your hand is actually going to cause more tissue damage and worsening tissue breakdown. So we want to discourage people from doing that. The right side has a couple examples of different types of seat cushions. So memory foam, gel foam, air cushions. The Roho cushion for your wheelchair is a great option if you can get your insurance to cover it. using like a gel memory foam pillow for your head is a really good option, as opposed to, again, a donut for the back of your head to prevent those pressure injuries on, it doesn't, this is more for people that can't move their head at all. I mean, if you're able to rotate your neck and bend your head forwards and backwards, this isn't really something that you need to be worried about. But for those individuals that are really bed bound, that can't move their neck, using a memory foam gel pillow is nice. And then again, the heel protector boots, at least while in bed, are helpful. Moisture associated skin damage is another topic for consideration for anyone with a spinal cord injury. So incontinence obviously is a big concern in the spinal cord injury population. If you don't have control of your bowel and bladder, your bottom area is going to be frequently exposed to urine and stool. So making sure that that you're using products that will wick away that moisture, and making sure that you maintain really good incontinence care, getting that wet or soiled brief or the incontinence pad on the bed off of you and getting cleaned up right away is going to be key to preventing skin breakdown related to incontinence. Excessive sweating is something that some people experience who have that their thermoregulation capabilities are hindered or disrupted by the spinal cord injury. So excessive sweating, especially if you have skin folds, that sweating can get trapped in the skin fold and the skin starts to break down over time. You're also at high risk of developing fungal yeast infections in the groin area and skin folds underneath the breast folds. Especially in Arizona. Again, we have the disadvantage of being in high temperatures for a lot of the year. So just being aware of that. There's a lot of really great clothing products out there that have, wicking technology in them. So that can help with that moisture control. And then, again, just with like the basic hygiene. High output wound drainage. So if you do develop a wound with a high drainage, or if you have a drain from a procedure of some kind, you can have drainage coming out around the insertion site. If you have a suprapubic catheter, sometimes those will leak around the insertion site, leading to exposure to moisture. So all of those things can not only contribute to moisture-related skin damage, but they can also contribute to that pressure injury development. So pressure injuries are not only caused by just pressure, but it's a combination of pressure, moisture, friction, and shear. So just making sure that that we're managing that moisture by using skin protectant products, moisture barrier ointments. If you're a male and you're incontinent of urine, a condom catheter is really helpful. There's a new product out called a PureWick that is really helpful for female incontinence. If you have access to a suction type of machine, you hook the PureWick up to a suction catheter, and it helps with getting that urinary incontinence away from the skin right away.
Question?
Oh, yes.
About the suprapubic. I have one.
Yes.
And I keep gauze around it to absorb, because there is a little bit of drainage, and it doesn't tend to be urine, more I don't know exactly
like a
what.
drainage.
Right.
Yeah.
And I keep gauze. Would it be better to put barrier cream around it every morning?
So Valerie, I think that gauze is really great. I would recommend that you keep doing that. However, when people are in the hospital and they have drainage from a suprapubic or another type of wound drainage device, we will use the moisture barrier ointment in a really thin layer on the skin, and then put just a layer or two of the gauze around the tube. Okay. Because the gauze does an okay job of absorbing some drainage, but it doesn't do a very good job of wicking the moisture away from the skin. So for however long that gauze is sitting on your skin, it's still exposing it to that moisture. And that moisture sitting on your skin for a long period of time can cause breakdown. So the moisture ointments, the Desiccants, anything over the counter, you don't have to get like a product from a medical supply company if you don't want to. You can go to the baby section at Target or Walmart and you can get, you know, choose whatever product you prefer. But yeah, putting a thin layer of a moisture barrier ointment or paste around the suprapubic catheter will do a really good job of protecting your skin.
Okay, so use both.
Yeah, use both. Use both.
Okay, thank
because
you.
even though you have the ointment there, it's not going to stop the drainage from coming out. And so the gauze will help keep your clothing clean and it will absorb a little bit.
Okay, thank you.
Yeah, you're welcome. That's a great question. The next picture, I've got a couple of butt pictures. So just FYI warning. These are two pictures of some incontinence associated dermatitis. So I just wanted to share some examples. These are really, you know, extreme cases. Usually people recognize that their skin is getting a little irritated, itchy, red, and they're able to address the incontinence associated dermatitis early on. But if you are exposed to urine or stool for a prolonged period of time, you will develop a chemical burn. And
Wow.
our right-hand picture is an example of severe incontinence-associated dermatitis. And in that case, you would want to use something with a significant percentage of zinc oxide in it. That tends to stay on those wet, moist wounds on the bottom area better than just, you know, an ointment that maybe only has a really small amount of zinc oxide or is mostly petroleum based. So again, just, you know, making sure. There's also a product out there, a couple of different products out there that are barrier cream cloths. So they're these cloths that you can use for incontinence care, and they have barrier cream impregnated in them. So that's another option out there for you if you feel like you have issues with your skin getting irritated and breaking down in the buttocks or groin region. So healing compromised skin. So if you do develop a wound, there's a couple of different things that we want to keep in mind. One is we want to ensure that we're increasing our protein intake. Protein is essential to wound healing. And whenever you have a wound, your body's energy stores are being used up a lot more quickly, and there's a higher demand for protein. And the process of wound healing requires proteins for that new tissue growth and reepithelialization. So there's all different kinds of protein shakes out there, protein bars, eating a well-balanced diet, increasing your making sure that you're taking a multivitamin every day. Vitamin A, C, D, and zinc are really helpful for wound healing. And again, just being aware of those pressure points on your body. So if you have a wound on your sacrum, on your tailbone, while that wound is healing, it's really important that you not lay on your sacral spine, that you either be kind of propped up on your right side or propped up on your left side and just alternating from side to side, not laying directly on your sacrum. If you have a pressure ulcer on your heel, again, making sure that no pressure from shoes, from your wheelchair, from your bed are pushing on that heel while it's healing. Having really good wound cleaning and wound care. So making sure that you're being followed at an outpatient wound care clinic or by your PCP, or that you have home health nursing coming in if it's anything more than, you know, past that first or second layer of skin. Anything deeper than your second layer of skin, you want to be seen by a doctor and get some routine assessment and management. And then making sure that while your wounds are healing, that you're continuing with that good mobility and range of motion. Sometimes when we have an area on our body that is that has a really painful wound, we don't want to move. And that's really detrimental to the healing process. It decreases the circulation. You develop swelling. Like if you have a wound on your lower leg and you're not moving your leg is going to get more and more swollen. And that edema, that swelling, is going to interfere with the healing process and prevent that wound from closing. So making sure that you're doing that active and passive range of motion is really important. Real quickly, just signs of infection and microbial colonization in the wound bed. If you do develop a wound and you start having increased pain, swelling, and redness, you develop a fever greater than 100.4. If you have increased skin temperature around the wound, or the skin around the wound starts to get more and more red and swollen, you have a foul odor, increased or bad colored drainage coming from the wound bed. And by bad, I mean green, creamy white, anything like that, that's a sign that your wound is getting infected. Or if you're doing really good meticulous wound care and it's been a week or two and your wound isn't getting smaller in size, that might be because there's a microbial colonization that's interfering with that healing process. And then finally, when to seek medical attention. So I went over this a little bit earlier, but if you have any of those signs of infection that we just reviewed, if you have a pressure injury that progresses past a stage 2, or a wound that's not showing signs of improvement or healing within 2 weeks, you develop excessive weight loss or loss of appetite, or if you're ever just in doubt, it's never wrong to ask questions or to be seen by a nurse practitioner or a doctor. Just to say, hey, like I need a professional to look at this and just give me some reassurance. All of those are good reasons to seek medical attention. And there's my contact info if you have any questions or want to share with me about your mattress that you got, Valerie, or anything else. Do you guys have any questions for me?
Yeah, so I've always wondered, okay, I was injured back in 2018, and I'm an L4, L5, and then I have an incomplete T4.
Okay.
I always wondered, okay, could the type of wheelchair like interfere and cause a pressure injury? Could a hospital grade wheelchair cause that?
Well, honestly, any wheelchair could potentially cause a pressure injury. So if the wheelchair is not fitting your body correctly, or if the seat portion of the wheelchair or the back portion of the wheelchair isn't padded properly or doesn't have enough cushion to it, then yes, you can get a pressure injury. If the armrests or the leg supports are rubbing on a part of your body incorrectly, that can cause a pressure injury. So yeah, I mean, any wheelchair can cause a pressure injury.
Yeah, because see, I learned that when I was getting fitted back in December for my quickie QRI. My doctor wrote a prescription and sent it over to Southwest Medical. And once they got the prescription, they went on ahead and had me come in for a wheelchair seating evaluation. And that's where I started really learning about all this stuff.
Oh, good. Yeah, that's awesome that they did that for you. Yeah, that's
my wheelchair is very comfortable.
Oh, good. Yeah. Every time I see someone with a good quality wheelchair, it makes me really happy, because I've seen people come into the hospital with, awful wheelchairs, and criminal. I don't understand how, our medical system and our insurance system is letting people live in wheelchairs that are just,
And see, I have a Medicare Advantage plan, and unfortunately, my Medicare Advantage plan only covers for those types of wheelchairs that you described.
Okay. Yeah.
And it was, I was in one for almost 2 years, and that was awful until I got my quickie QRI, and then comfortable now. So.
Oh, good. I'm glad you got it resolved.
I can tell you, this is Sharon. I know that my one and only pressure sore was that my one of the companies put a new backing into my wheelchair, and obviously the backing and the cushion, obviously my skin got caught in between the backing and because it was very high.
Right.
So there's no way it was on the sacral area. So, and it was on both sides, and I was down for 6 months. And so it was tough.
Yeah.
So at least I caught it as more of a stage 2.
Oh, good.
Didn't go any further, but I knew it right away. I felt something, that there was something wrong. So
yeah.
But yes, so that's to the question that yes, wheelchairs can, can be the cause of the pressure sores for sure.
Oh, yeah. I've seen many pressure injuries that were caused by poorly fitted wheelchairs, or wheelchairs that were just so worn out that they weren't providing any support or cushion between the patient's body and the frame of the wheelchair. So I'm glad that you caught that early, Sharon. That's, I mean, I love that you guys get together and talk about this stuff, because it makes everybody else in your community more aware and, a little bit more like conscientious about being meticulous with checking your skin on a regular basis.
Yeah. I mean, I have like a lot of my central nerve does end up being in the buttocks area. So that's just another thing to check every day. And I know some days are dry, some days are, I can feel that. So I'm always doing lotions and to keep it at a preserved level. But because once you have it, you're way more conscious of it.
Yeah.
And, it's always going to sometimes reappear in the same places that it was before. So
definitely
more susceptible to that area. So it does make you think about it more often, because I know we're all can all agree that we're not as great about weight shifting throughout the day, because we just got too much going on. That but skin checks are super important. But I definitely agree that pressure release is something you should be doing. But I know it's not every 15 minutes like the textbooks say.
Yeah. I love what you brought up, Sharon, about if you've had an injury somewhere, it's more likely to break open again in the future. That's a really good point. If you have, especially if you have a full thickness injury that develops scar tissue's tensile strength and elasticity is less than just our regular skin. And so it is much more likely to break open again, and you're at higher risk for developing a chronic open sore in that area. So that's really important to remember.
Yeah, because I did scar on one side, and so it is a little raised. You can still feel kind of the scar. So that's the one I'll definitely put cream on every day, just to be on the safe side.
Definitely.
Can I ask about how many hours does everybody spend in their chair versus either laying in bed or on a couch or different surface?
14 to 16 for me.
Yeah, I would say almost like 16 to 18. I don't get it.
Yep.
Yeah, I mean, in my chair, because I don't go to bed till about 2 o'clock in the morning, and then it's about 6 hours in bed.
Yeah.
Holy cow. Okay.
And I can't transfer myself, so I have to have my husband's here. He has to be here to help me. So once I'm in it for the day. But on the opposite, I've had 2 major sores in 18 years, and I've been down almost a year with both of them.
Oh dear.
Yeah, and in the same spot. It's always the same spot. The last one, I've had a red spot for about 9 months, but it's gone now. But it'll flare back up again.
Yeah.
It's just
hard.
Luckily, my husband's about keeping my skin checked for me.
You guys have any other questions that I can answer?
Nope.
Well, thank you so much for letting me spend some time with you guys. I really enjoy being able to talk with all of you, and I learned so much from you guys as well. So I really appreciate this opportunity. Thank you, Karen.
Thank you very much for your time,
everyone
Nikki.
Very, very good information.
Okay,
May
I'm glad it's
question.
Oh yeah.
Sorry, I was trying to get off mute and I couldn't hit the button.
Oh, that's okay, Cindy.
Anyways, Ashley just had a pressure sore that was, just getting healed.
Okay.
And it's just like in between the buttocks and maybe the crease there.
Yes.
And when so she's healed now, but I still keep putting like silver sorb and the gauze and then a ADD pad and tape it on there, just because I want to keep it protected because she's slide boarding. And so I don't know if that's what I should be doing.
Yeah. So it actually, a lot of times if you get skin breakdown in that butt crack area, in the crease between the butt cheeks, that's actually usually not pressure related, it's moisture related.
Mm-hmm.
And so the best thing that you can put there is a moisture barrier ointment or cream. And if it is fully closed at this point, Cindy, I would recommend that you discontinue the use of the silver gel, because that silver gel can macerate the skin and bring too much moisture to the skin that's fully healed, and it'll break open again.
Okay.
So I would stop doing that, and you can apply a moisture barrier ointment or cream to that area every day to protect it from moisture. And then let me go back. Oh, sorry, I'm still sharing my screen. I forgot. Let me
Karen, we can put the moisture cream, Karen and I use both the same. It's on Amazon.
Yeah.
Is what we use. And it's really, really good. So
I'm on.
Are you on there? Okay. That's why I thought you might be silent, because you might be looking on Amazon, but we can put it in the chat or put it on the,
this is the one I use.
but it's almost like, just basically, what you would give for, babies, it's the barrier cream.
Exactly.
It's just like even like zinc that can really thin the skin out.
Right.
So you really want to try more of a moisture cream. Sometimes when it's really dry, I'll use like Vaseline because it's just dry skin. But then, the other times when it can, it's going to be more, it just the other cream. I use the one that's on the orange one, Karen.
Yeah, because the one that Karen is showing right now is moisturizing, like it's like a lotion.
Yeah.
Remedy, this line, Medline, makes a really good line of products for skin health.
Yeah, right. It's the orange one.
The orange one, yeah. I think I still have some orange.
So
yeah.
Okay.
That's it says something more of a paste. So it's more of a barrier cream than a.
So this one, applying a really thin layer on her skin.
Okay.
Yeah, it'll be like a barrier.
If you're worried about, because she's slide boarding, if you're worried about her tailbone area getting hurt while she's slide boarding, you can put a sacral foam border dressing on her skin prophylactically. I just don't know how much insurance will reimburse you for that. But Karen, if you look up sacral foam dressing on Amazon, it should give her some examples. Oh,
yeah.
On there.
If I spelled right.
I mean, I use Cindy, I use a slide board all the time. I'm doing about 24 transfers a day, with, in and out of bed, on and off the toilet, in and out of the car, blah, blah, blah. So, but I just need that cream because it is in the car, I just need the cream. It's not really, unless she's really shearing. Right. It's usually when I had the open wound, and I even told the doctor, and that's when I had the dressing, but that was more on the, the buttocks area, that on both sides. So I'm like, I'll limit the amount of transfers that I'll do, but I can't promise you anything else. I got 3 kids to take care of. Right. So I did just use those Allevian bandages over the wound, and not necessarily anything else. But it can get, start to get expensive because you do,
Yeah.
do the shower, some
Right.
of them, actually the Allevian ones are water, I've been able to put, in the water, like take a shower with, and but because they seal, I use like a silicone kind of, like to keep the bandage in place.
Mhm.
But,
Yeah,
those are great.
there's all
So,
kinds of them.
there's
Okay.
all kinds of them, but the
Yeah.
Allevian ones are they're a little bit more expensive, but they're definitely worth it. But if it's really in that particular area, then I would say it's not the sliding that's doing it,
Right.
it's the moisture.
Right, because she was leaking. She was, she does have a catheter, but
Yeah.
the 23rd, I think she's getting the Botox in the bladder. And then in
Good.
October, she's having scar tissue on her spine, removed. So they want her to keep the catheter until then, and then she'll learn how to self-cath after that. So hopefully she heals good.
Awesome. Yeah.
Yeah,
both-
and always reach out, if she needs help, or let me know.
Okay, sounds good.
Yep, we're just a phone call away.
Okay, thank you.
And remember, I'm in Mesa, so
Okay,
I can always stop by.
okay, thank you.
Cool. Sherry, I'm glad you made it, that the link worked for you.
Oh, thank you.
Yeah, sorry, I didn't see your email earlier.
No problem.
Yeah, I recorded it so I can send it to you too. Any more questions, ladies? That was all else today. All righty, I'm gonna stop the recording, so.